What are we doing here today?
We are showing support for these fantastic workers. These key workers are always key workers. These are the people who kept us safe, risked their lives during the pandemic, and are being insulted with an absolutely awful pay offer from this government. And we're here to support them in their fight for pay and conditions. These are the people who look after us. It's time we looked after them.
We're hearing from the Tory government that they're not going to agree to any of the pay rises that the RTN have put forward. Do you think this is part of the managed decline that some commentators are talking about with the NHS?
I think that's a really polite way of putting it. I think it's a violent attack on this service. They did it, Conservative governments historically around the railway and so on. They are actually consciously undermining a service. But when you do that with something like the NHS, it means people die. And this government knows that. I mean, it's not that long ago that the NHS was rated as the best healthcare service in the world. It's not 20 years ago, it's 5 years ago. And the government says, oh, it's a broken model, they can't keep pouring money in. That's just an outright lie. The NHS faces 32 billion a year annual deficit at the moment because of 12 years of austerity. It's refusing to pay staff properly when there's 132,000 staffing vacancies in the NHS at the moment. No wonder staff are getting burnt out and walking away. They can't do the job that they want to do.
The Health Minister is a nurse and she is a Royal College of Nursing member, but she didn't vote in to go on strike. Why do you think she's not taking part?
Well, I think it depends on which allegiance trumps the other, and clearly her class allegiance or her party allegiance trumps her allegiance to her union and to her fellow union members, and I think it's a disgrace, to be honest.
Would you agree with some of the tabloids that say the nurses are putting lives at risk by going on strike today?
I would say that nurses are doing everything they absolutely can, and the unions are doing absolutely everything they can to keep people safe. But it's the government that's putting lives at risk. You know, we've got people dying in ambulances, outside A&E departments, meters away from life-saving care. 7 million people on waiting lists for, serious operations that could make the difference between life or death. And the government knows this, and it's refusing to do anything about it. In fact, what it's doing is doubling down on its refusal to respect and honour the workers that keep us safe, as I say.
And what would be the benefit for them?
For the government? Well, the government wants to privatise the NHS. That's its end game. And it's already privatised services within the NHS. Most non-clinical services are already outsourced to private companies. And those workers, those cleaners, those porters, those catering staff, those couriers and so on and so forth, they are already on worse paying conditions, and these workers here are forced to go on strike. Nurses are being forced to use food banks. Some hospitals are even facilitating the distribution of free food. And the cost of living crisis is biting so hard. It's affecting almost everybody in this country. And for it to be affecting so severely people who have followed a vocation to protect and keep well is an insult to everybody in a decent society.
Are you surprised that Labour decided not to back the 19% pay increase?
Well, Labour's a really broad church. I am disappointed, to say the least, in the Labour leadership. I'm disappointed in Keir Starmer and Wes Streeting, especially. But there are some fantastic Labour MPs who I know will be sticking their neck out and coming down and supporting these strikes as well. So, and in the context of their leadership, betraying, if you like, these workers as much as they have. And I do think it's a betrayal. I think it actually shows the kind of great strength and courage of conviction of those MPs that will come and support regardless of where the leadership is.
I don't suppose you saw Wes Streeting's article in The Guardian last week where he called for more privatisation of the NHS. What do you say to that?
I'd say he's wrong. I'd say he's being weak. I'd say he is of a kind of idea, if you like, that the way to win votes is to shift to the right and to appease a kind of, I would argue, a kind of imaginary layer of voters who are wanting to privatise the NHS. I think that's just wrong.
You don't think the public wants to privatise the NHS? The public?
No, I think the public absolutely don't want to privatise the NHS. Some people quite rightly will ask, well, what's the difference between private and public health provision? But at the end of the day, you know, when people are seeing worse and worse services, and people who are ending up in private services, if anything goes wrong, they end up being referred straight back to the NHS. Anyway, the NHS is incredibly popular in this country. Poll after poll says they want to remain in public hands. And as long as we find the political will to get it back to where it's been very, very recently, I think we'll get rid of any arguments for privatisation that are being dripped down from above, not from below.